Hello everyone. I'm glad you could join me for our 15-minute webinar on calendar year 2018 outpatient prospective payment system changes. There are over 300 CPT changes this year, and today we will be discussing a few new CPT codes and one new HCPCS modifier for calendar year 2018. As always, a reminder that the educational materials such as this presentation and its contents are protected by copyright law. These slides may not be revised or redistributed without express permission of iMedX. There have been almost as many new codes as revised in the Evaluation and Management section. One of the 5 new CPT codes is displayed on this slide. CPT Code 99483 describes cognitive assessment and care plan services that replaces HCPCS code G0505. This code is used in the office or other outpatient setting, home, domiciliary, or rest home. This is a new subsection with guidelines and parenthetical notes. If all the required 10 elements are not performed nor met, then an appropriate evaluation and management code should be used instead. Lastly, CPT code 99483 is allowed only once per every 180 days. For 2018, we have just as many added as deleted codes from the Anesthesia section. One of the 5 new codes is listed here. CPT code 00813, which is related to upper and/or lower GI endoscopic procedures. This code was added and offers more specific data when captured and coding of endoscopic procedures. The integumentary system has 3 new codes. Since we receive many questions regarding flaps, one of the 2 new flap codes is shown on this slide. CPT code 15733 captures a muscle, myocutaneous, or fasciocutaneous flap with a named vascular pedicle. The CPT Assistant from November 2017, page 6, volume 27, issue 11, clarifies that CPT code 15733, muscle flaps of the head and neck, is described as larger and based on a named vascular pedicle. The only pedicles for this code are buccinator, genioglossus, temporalis, masseter, sternocleidomastoid, and levator scapulae. Continuing in the surgery section, the only new code in the musculoskeletal system is an add-on code. CPT code 20939 was developed to identify bone marrow aspirations for bone grafting during spinal surgery. This code can only be used with spinal surgeries. As for the respiratory system, several changes were made to the sinus endoscopy section. One of 6 new codes in the respiratory system is demonstrated here, which provides greater procedural specificity. CPT code 31253, nasal sinus endoscopy, surgical with ethmoidectomy, total anterior and posterior, including frontal sinus exploration with removal of tissue from frontal sinus when performed. The cardiovascular system has an extensive number of changes this year. We have only provided one of the numerous new CPT codes from the cardiovascular section. CPT code 34701 relates to the endovascular repair of an infrarenal aorta by deployment of an aorto-aortic tube endovascular repair. This new section of codes describes the vessels involved and a description of what is included in the procedure. CPT code 34701 is performed for any condition other than when a rupture is documented. There have been very few changes in the hemic and lymphatic system, with the exception of revisions to clearly capture diagnostic services related to bone marrow aspirations and biopsies. One of the two new CPT codes in the Hemic and Lymphatic System is 38222 that has been created for those instances where both a diagnostic aspiration and biopsy are performed, is presented on this slide. Just a reminder that bone marrow aspiration for bone grafting during spinal surgery is captured using new CPT code 20939, as we previously discussed. Other than some parenthetical note changes, the digestive system has only added a few new CPT codes. One of the new codes, CPT code 43288, describes a tri-incisional approach, which is using open, laparoscopic, and thoracoscopic approaches for various parts of the procedure. For example, CPT code 43288 is assigned when a thoracoscope is used to mobilize the upper, middle, and lower mediastinal esophagus during a laparoscopic proximal gastrectomy, an open cervical pharyngogastrostomy, or an esophagogastrostomy. Moving on to the male genital system, the only CPT code added was to the Other Procedures heading. CPT code 55874 was once a Category 3 code. It captured the injection of biodegradable material between the prostate and rectum to preserve tissue that is not involved in radiation treatments during management of prostate cancer. Ultimately, the biodegradable material is absorbed by the patient's body and excreted. CPT code 55874 reports transperineal placement of a biodegradable material, single or multiple injections. When performed, image guidance is included. A small number of changes have occurred in the female genital system. The only newly added CPT code, 58575, was created to capture laparoscopic total hysterectomies for the resection of malignant tumors. It includes an omentectomy and salpingo-oophorectomies when performed. The nervous system is the last subsection we will discuss in the surgery section before moving to radiology. There are numerous new guidelines as well as parenthetical notes. An example of one new CPT code is 64912, which describes a repair of the nerve with nerve allograft on each nerve first strand. Nerve repairs are performed by suturing the ends of the severed nerves to strands of the allograft using a microscope for vision. Do not code the microscopic procedure separately. There have been lots of changes and updates in the radiology section. We are sharing only one group of new CPT codes on this slide. The new chest X-ray exam codes 71045 through 71048 have removed the specific area X-rayed from the code description and now is coded according to the number of views. This does not diminish how the procedure is performed. Next, the Pathology and Laboratory section has almost as many new and revised codes as the surgery section. One of these codes is CPT code 81541, a mortality risk measure test, which was added to report the aggressiveness of prostate cancer. Lastly, there have been many new CPT codes added to the medicine section. Revealed on this slide is one of the newly added codes. CPT code 96574 was added to describe a destruction of premalignant lesions by a physician or other qualified healthcare professional. The physician or other qualified healthcare professional must be involved with the treatment of photodynamic therapy directly in order to report this code. If not, there is a different CPT code which should be used. We have finally reached the modifier section. Before we talk about the new HCPCS modifier, I would like to remind you that last year modifier FX was created and is to be used when an X-ray is taken using film. Similar to modifier FX, CMS has implemented a reduction in computed radiography technology, or CRT services, as of January 1, 2018. X-rays taken using CRT now requires HCPCS modifier FY and will result in a reduction of payment. CMS is trying to encourage sites to use digital rather than traditional X-ray imaging formats such as film and cassettes. Are you interested in learning more about the other newly added, deleted, and revised code changes for OPPS calendar year 2018? Please join us for an in-depth discussion in our 1-hour webinar, Calendar Year 2018 OPPS Regulatory Update, in which we will further discuss more of the 170 added, 82 deleted, and 60 revised codes. Also, major provisions, laboratory test changes, new technology APCs, and finally, inpatient-only procedure list changes and APCs. As an added bonus, support from our coding experts is available to answer any additional questions you may have after viewing the webinar. To purchase the full comprehensive webinar, click the first link in the video description below. The full webinar has been approved for 3 AHIMA CEUs or 1 AAPC CEU. Please let us take a moment to let you know a little bit more about some other iMedX education opportunities. iMedX believes in a humanology, that's humans plus technology, approach to health information management. Bringing together innovative technology and unparalleled experience to give our clients a significant edge in clinical documentation is our goal. Our education team is comprised of experienced education consultants. Our consultants have trained over 1,000 coders in ICD-10 and serve as our expert resource for our own coders and consultants. Our team is flexible and can provide live custom training to fit your facility's needs. We also offer at-your-own-pace training through iMedX University, which is our online learning management system that combines interactive multimedia with a vast array of course and content options to cover any student's needs. You are also experiencing a brief overview of one of the trainings that we offer, which is coding webinars. Some of the trainings that we provide are other 1-hour webinars, advanced training for PCS, ICD-10-CM, ICD-10-PCS, and CPT training. Training Code, which is a program that offers one-on-one mentoring to train beginning coders or enhance coding performance of existing coders. Intermediate ICD-10 workshops, and custom education development for organizations. We are also in the process of developing a clinical documentation improvement program. To learn more about these education opportunities, please visit our website at imedx.com/edu, or simply click the link in the description below. Our entire education team at iMedX would like to thank you for providing us with the opportunity to share our knowledge with you today during this 15-minute webinar. We hope you can join us next month for our next Focus 15 coding webinar.